Oh, you guys want me to close?
Yeah.
Hi everybody. Yes, thanks Maria. Hi everyone. Thanks for joining us today. It is, excuse me, it is Midwife Monday. Here at the SCV Birth Center, we're super happy that you're choosing to join us and listen to this on free time. Okay, so Breast Cancer Awareness Month. It is October, and I have the lovely Angie Morgenstern sitting next to us. Many of you know Angie as our office manager, and basically she runs the joint and makes sure everyone is doing what they're supposed to be doing. And if it wasn't for Angie, I would be out of business probably. Nobody would have a chart. It would be a problem. So thankfully Angie, who's been with us now for a couple of years, came on board, and we're going to talk about breast cancer because our lovely Angie has had the lovely opportunity to experience it. And so we want to dispel some myths, about how to test for it, when to test for it, why to test for it. And, you know, it has really changed my point of view, actually. I was a big proponent of don't get a mammogram. Mercola says, don't get a mammogram. And that's really sort of in my wheelhouse. And I was like, yeah, I'm not doing that thing. Like, I don't need that radiation. I don't have a family history of breast cancer, although I have a crazy history of cancer in my family. Hopefully, I will live past the age of 60. Debatable. But hopefully I will. And, but I was really the person saying, no, I'm not doing that thing. Even having a palpable mass. And me in my clinical education saying, oh, I'm sure it's just a cyst. I breastfed for so long. I've had this for so long. I'm sure it's a cyst. And it was a cyst. But I never had it looked at because I didn't want to go in for a mammography because I thought I have no breast tissue. I would be able to identify if I have something going on. The Lord did not bless me with
Ample bosom.
So, okay, so we're going to talk about that. And we have some numbers here because what's very popular right now, and Angie and I have been talking about this, is thermography for breast cancer detection. And we really want to be able to offer what is evidence-based, what is the standard of care, and we want to be able to counsel our families on risk-benefit of different modalities of checking for breast cancer. As you know, well, first, Ange.
Maybe we should tell them a little bit about my story.
Yeah.
So I have no family history of breast cancer. The women in my family stroke out at 90, and I thought that was going to be my future. But in my case, I was doing a breast exam while I was watching the Olympic Games, Summer Olympic Games, and I felt a lump. Just a little tiny lump, like a little pea. And I came into the office the next day, and I said, Renee, what is this? And she felt it, and she's like, oh, that's probably nothing. Here, feel mine. And she had a similar one on the same side, and honestly, they felt exactly the same. And she said, but you really should go in and get that looked at. So
I think I might not have said that.
I'm trying to save face here.
I think I'm like, Ange, I'm sure it's nothing.
And I'm like, I'm not going to listen to her. I'm going to go in and get this
That's
checked.
the truth.
That's really what happened. So I went in and got a mammogram. I was 43 years old, so I was diagnosed last August. And I had gotten a mammogram right when I turned 41, because I was under the impression that that's something that I needed to do once you hit 40. And what I did wrong is I went a year and a half between mammograms. So when I went in for my mammogram at 43, I said, I got something over here. And they looked at the mammogram results, and it's like, we don't see anything. And I was like, I got something over here. And they followed it up with an ultrasound immediately. Promptly sent me in to get a biopsy the next couple days.
Yeah,
They came with me.
So fast.
They were fantastic. And it came back as positive for...
And what was striking, and it was awesome actually, when we went for that biopsy, the nurse was like, look, I see this all the time. Don't worry. What we saw and the way your age, I'm confident that it's nothing. Remember?
Right.
And which was comforting, yet wrong.
And I could have just ran with that, right? So I get a call from the doctor who sent me to get the biopsy to come in on Monday morning at 8 a.m. I knew that wasn't a good sign. My husband and I went in and they told me I had DCIS, ductal carcinoma
in situ. In situ?
No, I think
That's
I've been living this
I'm
for
not
a year and a half.
ductal carcinoma.
Anyway, I had garden variety breast cancer. At that point, they knew that it was fueled by estrogen, and then I needed to go in and have some surgery to get it removed.
Not all cancers are fueled by estrogen. Some are estrogen dominant, some are not.
Right. So
We are not oncologists over here.
I went in and I didn't want to have fake boobies, so I opted for just a lumpectomy on this side.
I would have just personally give me some.
But you have that choice.
Yes.
You have that choice. And then I endured 5 months of chemotherapy and 31 or 32 doses of radiation.
They knew going in, once she did the biopsy and the doctor talked to you, you then did this lumpectomy. They identified stage 1 so they could appropriately treat.
After the surgery, however, they diagnosed me stage 2 breast cancer. So when I look back on this experience, I think, man, if only I had gone in for my mammogram a year after my first one, because my cancer barely touched one of my lymph nodes. So it metastasized, which all of a sudden made me a candidate for chemotherapy. I could have avoided that whole nightmare if I had gotten in time and saw.
So my argument, though, is, but they didn't see it on the mammogram.
In my particular case, I have dense breasts, so mammogram couldn't see it.
So given the fact, once you have a diagnosis of dense breasts, which many women do, an ultrasound is the standard of care to follow up on all women. So if she had gone in at that next mammogram, we would have known already from the previous one that she had dense breasts, and we would have ordered a follow-up ultrasound. And that's where it was found. So women are concerned about getting mammograms and it's not finding breast cancer. But here, as your provider for Well Woman, we can order your breast exam. We can order your breast imaging. So knowing that Angie had dense breasts, we could have annually, and we would annually, but now she's got a special fancy doctor for that.
And a special test called an MRI annually.
Yeah. But we would now say, let's get an ultrasound, because we do know what the studies show is that is the standard of care. Mammography first to identify dense breasts. Then once we have a dense breast diagnosis, we will then just automatically follow up with an ultrasound. And very common and popular, not so common, but very popular coming up in conversations right now is thermography. And we did have a conversation with Angie's oncologist, who was wonderful. He also, prior to being an oncologist, he was an acupuncturist, right? Yeah. So this guy isn't just like, medication, chemo, doesn't know anything about holistic healthcare. The guy was really, really wonderful doctor and really understood different modalities of care. And so I felt confident when I asked him the question, because I would go with Angie to her chemo, what do you think about thermography? And he was like, it's just, we're not there yet. Thermography, I just did a research, I just Googled it, not Googled it, I have a database, a medical database called Up to Date that we reference with, because we're an evidence-based practice, which you hear us say all the time. With thermography, which is heat, right? Because we know that cancer cells generate heat, and with this thermography, we can identify hot spots in the breast, which is super cool and no side effects from thermography. Yet, if there's any finding in thermography, the next course of action is a mammogram, which we would then refer out for an ultrasound. So we would actually get some actual data. But there's currently, as of today, with thermography, there's a 25% false positive. Okay, so you'd always rather a false positive than a false negative. 60% chance of a false negative with thermography, which is problematic. 60% of women are thinking, well, we're fine if we're doing thermography, and they're wrong. So we don't really think that's a great modality as of today. Ultrasound is really a great modality. MRI is a great modality. Mammograms, the recommendation is between the ages of 40 and 44, your choice if you want to go in annually. And there are a lot of factors that will make that determination for you. 45 to 54, annual mammography is recommended. In Angie's case, she was in the 40 to 44 range. didn't really need to go back for annuals. It was her choice. The mammogram may not have found it, but due to the first mammogram identifying dense breasts, it would have given us the ability to say, annually get an ultrasound. Because we know with dense tissue we can't see mass as well. So
the other thing we learned about thermography when we were reading about this on the up-to-date medical website was that it can find things but not early enough.
yeah,
Mammograms
early
and
detection was poor.
And early detection is the key to all of this. My survival rate is significantly higher than somebody who has a stage 3 breast cancer or a stage 4 breast cancer.
Yeah. So we encourage everyone. I went in as soon as Angie had this finding, of course. I went over to the wonderful, right here in Santa Clarita, we have the Sheila Vilos Imaging Center. They do great work, you guys. They do great work. We refer to them. So I went in, I scheduled my mammogram, and because I had a palpable mass, I was able to get straight in. They did an ultrasound, and then they followed up. They did a mammogram and followed up with an ultrasound. And indeed, what I had was a benign cyst.
Mammograms don't hurt.
Mammograms don't hurt.
They don't hurt.
So the concern...
And they take like 5 minutes, and they don't hurt.
Yeah, define hurt. It might not be uncomfortable. It might not be comfortable. Those of us that are not ample bosomed. I was like, dude, I think my face is in the way. I can't get my breast in there far enough because I have no breast at all. I was basically smushed up to the machine, turning my head to the side, and I didn't have any discomfort. But I know Dr. Mercola, a lot of you are very familiar with his website. He's got some good information on there. He does have these big headlines that say, mammograms increase your risk of cancer.
What increases your risk of cancer is staying alive. 1 in 8 women will develop breast cancer.
1 in 8, regardless of family history.
I had no family history. I was
And
a
you're
mountain
BRCA.
biking fanatic, eating clean, doing
Yeah.
all the hippy dippy stuff she wants me to do,
Yeah.
and I still got it. So,
BRCA negative. So no family history, because then they'll do some genetic testing. So, okay, let's just, this is so much information. It's not really in our wheelhouse here. Obviously, we don't diagnose breast cancer. We don't treat breast cancer. But what we do is we refer out for annual screenings.
And you've had a handful of them.
Oh my
that have
gosh,
come back.
since this happened, we've had
That you
several
sent.
phone calls, of people saying, hey, I have a mass. And even if the trick is if you're breastfeeding, masses, plugged ducts happen, a variety of things go on. We have been very quick to say, look, let's just get an ultrasound of that. Let's just get you in there for an ultrasound. And we are happy to refer for ultrasounds for any palpable mass, even if you are breastfeeding. And we've come to the conclusion that it may not be a plugged duct. So always call the office. We are able, and it is within our scope of practice, to make those referrals. We also have an ultrasound tech that will come here and do some ultrasounds on your breasts if necessary, if you are uninsured. Also, if you are uninsured, you are not a legal resident.
There are clinics throughout Los Angeles that will offer mammograms.
For free. Yes, for free.
If you need a list of those, you can call Sheila Vilos and get them. That's what I did for a couple of the women I've run into that fit that criteria.
That are afraid to go. They might be, they're not legal here in the States. They don't have any health insurance. They're frightened to go in. Call us or call the Sheila Vilos Imaging Center here in Santa Clarita, and you'll get a list of resources. So the big takeaway is breast cancer happens to 1 in 8 women. It's terrible. It's terrible. Watching Angie have her experience is just really, it was really intense, and very selfishly, because if she's not here, we can't run the office. And those of you that were part of the practice while Angie was going through her treatment might have sensed a little disruption in the running of the practice. And we used to joke that we would close the office every Tuesday because I would go with Angie to chemo.
Every chemo.
Because I had a vested interest
in keeping me alive.
But it is no joke. And how you choose to treat it, we are not discussing alternative cancer treatments versus conventional cancer treatments. Because, man, until you're sitting in that hot seat, you have no idea what you're going to do. And that is the bottom line. So we support any way that you want to go about your treatment.
Mm-hmm.
But stage 2, caught early, it is still kicking your ass,
Mm-hmm.
I have to say.
Still.
And she's out of treatment.
Mm-hmm.
So this is no joke. Okay, she was a breastfeeding mom, super healthy, no family history, an athlete, and there you go. So the takeaway is ages 40 to 44, annual breast exams are your choice. Ages 45 to 54, once a year it is recommended that you do your mammogram, or I think personally an ultrasound is a better way to go.
Mm-hmm.
So we can help you figure that out. 55 and older, every 2 years is an appropriate course of action. Ultrasound is very effective. MRI is really, really effective. Thermography at this point, the data isn't there yet, and the follow-up, if there's a finding, is with a mammogram. So any questions or concerns, please feel free to contact us here at the SCV Birth Center. I don't know what that signal was.
Kelly has a question.
Yeah,
Question.
we had a question come in from Becky Metcalf. She
Hi,
said,
Becky.
Hi, Becky.
for someone who hasn't gotten any sort of ladies checkup, aka PAP, breast exam, etc., where would you recommend or refer to? Not that it's been over 4 years or anything.
Yes, so come here at the SCV. So a lot of options. At the SCV Birth Center, we are licensed midwives. We are licensed to do all your well woman exams. The recommendation is a PAP every 3 to 5 years if you've never had a positive PAP result. If you're with the same partner, those are some criteria. If you are having multiple partners, or you have a new partner, or you've ever had a positive PAP with abnormal results, then we recommend, there are different recommendations, at least once a year, possibly once every 6 months. It depends on your age and your history. But we do all of those exams here at the SCV Birth Center. Insurance may or may not cover them if you're coming to us. We will make referrals to appropriate caregivers in the community. We have some wonderful gynecologists that will do all of that care for you, depending on your insurance. So it's lovely when you come here. We do a 1-hour well woman exam. We talk about nutrition. We talk about supplements. We talk about your lifestyle. We do a very comprehensive breast exam. We talk about how to do a variety of things for your own body, knowing what's going on. And we do a lot of education at our 1-hour well woman exams. And of course, we love to see young women starting their well woman exams with us, especially if it's going to be your daughter's first, or if you're 18 and older listening to this and you're sexually active, which most 18-year-olds probably are. My children are not.
Tell yourself that, right?
Okay. So this is a great place if you're going to get your very first well woman exam. Let me tell you want to do it with a midwife, because we are it's warm, it's kind, we take our time. It's really the way you want to go. But yes, for women in their childbearing years, every 3 to 5 years if you're with the same partner, more frequent if you have multiple partners or a new partner or any abnormals. Yes, so the takeaway is,
do yourself breast exams. Feel yourself up, even if you don't know what you're doing. Just know what's
what your
normal
breasts
for
feel
you.
like. Mm-hmm.
I also wanted to give a shout out to City of Hope, who opened
my gosh.
offices here in Valencia about a year and a half ago. It's a really special place.
They are up here in Santa Clarita. That's where Angie did all of her treatment.
Yeah.
The doctors were amazing. The nurses were awesome. The facility was great. I mean, it's still chemo, which is terrible. But I mean, nobody can make it good. But they have lovely recliners that are nice and toasty warm, and blankets, and they made space for all of us that would join Angie at her chemo, and they did a really awesome job. And it's terrible. And
Your kids need you to stay alive.
Angie's children at the time of diagnosis were how old?
7, 10, and 13.
Super scary, you guys. So call us if you have any questions. We're happy to refer you to the appropriate caregivers. We have wonderful providers up here in Santa Clarita that are doing great work. And there you have it. So thanks for joining us, and check us out at scvbirthcenter.com, iTunes. This is uploaded to our podcasts. And like us, comment, share with your friends and family members. Thanks, you guys.
Thanks.
Have a great day.